Hi there, my name is Victoria Lacey. I'm a cognitive behavioural therapist and I've got 12 years experience working primarily within the NHS in the United Kingdom. I have completed a cognitive behavioural therapy postgraduate diploma with distinction, and also the psychological wellbeing practitioner sort of postgraduate certificate. I'm also trained in other modalities, including acceptance and commitment therapy, dialectical behavioural therapy, and compassion-focused therapy. I'm also fully accredited with the BABCP, so that's the British Association for Behavioural and Cognitive Psychotherapists. So today I am here to distill my extensive experience of working with Beck's cognitive therapy model for depression, and I want to convey this into a concise course for you. My goal is to offer a really practical approach on how to implement this protocol and master cognitive therapy techniques for depression confidently with your patients. So if you sign up to the Cognitive Therapy for Depression course, we are going to cover an introduction to cognitive therapy for depression. I'm going to tell you a little bit about the theory behind it, and we are going to look at some assessment skills, really focusing in on how to build that therapeutic relationship with your patient to ensure that you get off the ground running to ensure success for your patient. We're going to cover the typical outline of therapy sessions because this is something that I felt was lacking from my training, and I'm sure this will help you to really do well with your patient from the outset. We're going to look at behavioural techniques as well as those basic cognitive techniques. And I'm also going to kind of work with you on how to spot and work with those rules and assumptions. This course will also include considering some specific techniques that you can use for suicidal patients, and we will look at therapeutic challenges along the way. Now, this course is tailored for those who maybe have another psychotherapeutic modality training. They might be mental health professionals. You might be an aspiring cognitive behavioural therapist seeking to delve deeper into cognitive therapy for depression techniques developed by Aaron Beck. Well, if you're looking to expand your cognitive therapy techniques and help transform the lives of people experiencing depression, then this course is for you. Don't let your desire to help others go unfulfilled. Embrace your role as a beacon of hope. This is your chance to make a lasting impact that truly matters. So enroll today and embark on this incredible journey of genuine transformation, and do it with me. Thank you for listening.